Hello, my dear student. This is Professor Dr. Satish Polshettiwar from MIT World Peace University, School of Pharmacy, Pune, India. Today, I'm going to talk on the topic understanding of emulsion. Let's begin with this topic. In this today's topic, we are going to talk about what is emulsion, how we can classify this emulsion, that is types of emulsion. Then we'll discuss about advantage and disadvantage of this emulsion. Then formulation strategy, how we can formulate this emulsion. There are different techniques are there where one can formulate the emulsion. Then physical instability, also we will discuss about the factors which will improve the physical instability, and we will learn how to preserve the emulsions. These are the things that you are going to learn from this today's session. So first we'll talk about what is emulsion. Okay, so emulsion is nothing but it's a biphasic liquid dosage form. If you're talking about the liquid dosage form system, there are different systems are there. We have emulsion, we have suspension, we have lincters, we have syrup, we have so many solutions, mixtures are there. Okay, so this is one of the biphasic liquid dosage form system consisting of two immiscible liquid. One is oil, another is water. That is called as two immiscible liquid system, one of which is finally subdivided, like we are finally it is being converted into fine globules, divided, that is we call it dispersed phase, and uniformly distributed throughout the other dispersion medium of continuous phase, that is mostly water. That is we call as emulsion. This is a thermodynamically unstable system. Why it is called as thermodynamically unstable system? Because here the globule size, particle size, surface area is there. The free energy, more the surface area, more would be the surface free energy. Okay, so because of that surface energy, it is highly thermodynamically unstable in nature. Okay, it's a heterogeneous system since it is made up of two system. Okay, it's a heterogeneous system, it's a biphasic system. If you just see the classification of this emulsion, it has been classified based on the number of phases and based on the globule size. So based on phase, it is simple emulsion and multiple emulsion. Based on the particle size or globule size, it has been classified into different types. One is a simple emulsion, that is OW type, a W type, where the globule size is range 0.1 to 100 micron. Another type of emulsion that is called as multiple emulsion. Name itself indicates a multiple, that is water in oil, oil in water, oil in water, water in oil. That is called as where oil is a continuous phase, in one other phase the water is continuous phase. So another type is we call as advanced version of this system, where the globule size has been reduced, having the size 0.25 to 25 micron. That is called as micro emulsion. Name itself indicates a micro in a fine emulsion we called as. Okay, so another type is what we call as nano emulsion. It's all again further advancement of this emulsion system, nano emulsion. We all of you know nanotechnologies nowadays are very popular because it will target the cells without producing any side effects. So that's why we always prefer nanotechnology, having size 50 nanometer to 500 nanometer. That is we call as nano emulsion. You could see here the micro emulsion and the nano emulsion, how it appears. The best example of simple emulsion is your milk, which is called as natural emulsion, because it contains naturally it's a mixture of your oil, fatty acid and water, and it contains surfactants, that is natural surfactant we call as casein. This question may appear in GPAD, which natural surfactant present in your milk, that is we call as a casein, which is the example of oil in water emulsion, because water is continuous phase. In example of OW type emulsion is we call as your butter, cheese butter, okay, where the oil is your continuous phase. And the example of the formulation which is based on emulsion is your cream, lotion, liniments, ointments and some drops, which is called as the preparation which is based on emulsion. Now what is emulsion? Emulsion is thermodynamically unstable system. Okay, but this micro and nano emulsion are thermodynamically stable system, because since it is having very less surface energy, because particle size, globule size is very fine. That's why surface energy is very less, and we are adding some electrolytes and some surfactant emulsifying agents so as to bring the zeta potentials always we maintain more. Okay, so as to maintain that repulsive force. This is the thermodynamically unstable system. At least two immiscible liquids are there. One which disperse as a globule, that is called dispersed phase, also called as internal phase. Another is continuous phase, which is mostly water, which is also called as external phase, which is stabilized by using a emulsifying agent, also called as emulsion. It could be hydrocolloids, it could be surfactant, that is we call as emulsifying agent. In case of OW type emulsion, we use mostly HLB value having 8 to 16. In case of water in oil emulsion, we use HLB value having 3 to 8, mostly span. In case of OW type, we use twins. These are the examples of the surfactants and emulsifying agents. What is the rationale behind emulsion? Why we make emulsion? Okay, For oral administration of oil soluble drug, those drugs which are not soluble into water, then we can, those drug which is oil soluble drug, we make the oil water emulsion to enhance the palatability of the oils, because oil we cannot take it into this. If you want to make it, if you want to take this castor oil, castor is not palatable, arachius oil and all. If you want to give that oil by oral administration, then it has to be given by this route, where it improve the palatability of the oils. When given orally by disgusting both taste and oiliness, you cannot administer this castor oil as such. But if you make it in this form, oil emulsion, then definitely it has enhanced the viability, it enhanced the dissolution rate, absorption rate. Okay, increasing absorption of oils, oil soluble drug through intestinal wall. Example, grisofulvin is not, it's called as water insoluble drugs. It is oil soluble drug. It's suspended in oil in water emulsion, and one can deliver to that. Another is we can give by intramuscular route. Okay, like soluble vaccines we are giving by this W emulsion type, which provide a slow release. We can make it sustained release form, therefore greater antibody response and long lasting immunity. That is the rationale why we prefer this emulsion as a dosage form, because whenever we are making the dosage form, always you have to give a rationale behind that. So what are the advantages of this emulsion? Mask the unpleasant taste. Just now we have seen in case of castor oil. Increase the viability. Okay, we can make a sustained release via multiple emulsion. In food and cosmetic, it is widely used for proteins and other things. We can improve the stability and functionality. Emulsion provide protection against drugs which are responsible for oxidation hydrolysis. Any preparation such as cream, lotion are formulated in emulsion form. Intravenous emulsion containing fats, carbohydrate, vitamins can be administered. Drawback is that only due to coalescence emulsion, it has a very short life. But that can be prevented by using a suitable emulsifying agents. So always you have to choose a proper emulsifying agent. Mostly it is used in combination, one or two. The strategy, it can be prepared by dry gum method, wet gum method, and bottle method. What is dry gum method? Where the oil we use, it is being mixed with the gum with suitable proportion, then triturate it just to reduce the particle size, global size of that oil. Then we add water, then again triturate. Result is called as primary emulsions. Then another method is wet gum method. It's called as English method, where you take water, then gum, then it has been triturated in mortar and pestle, then we add oil, again triturate. Result we getting, that is called as primary emulsion. Then bottle method also there, that is called as force method, where we use oil. It is used for the volatile oil and non-viscous oil. So we have mostly in pharmaceutical field 4 types of oil. Fixed oil, it could be volatile oil, it could be mineral oil. Fixed oil, mostly castor oil, cod liver oil, shock liver oil, and olive oil or almond oil. Volatile oil, mostly we use turpentine oil, sandalwood oil, cinnamon oil, and peppermint oil. Mineral oil, we have paraffin oil, and one more oil is there, that is oleoresins. So making emulsion, always you have to think about this. You have to choose proper oil, you have to choose proper emulsifying agents. Okay, then and only one can make a stable emulsion. Always you have to think about the particular global size, think about your core component, think about your interventional composition change, aggregation state change, physical change, environmental change. All these factors you have to consider while making the stable emulsions. This is one example how we can make a we call as multiple emulsions. Okay, this is example of type of emulsion we have been developed using layer by layer technique. Okay, which consists of direct absorption of oppositely charged polyelectrolytes layer, example polysaccharide, and primary layer of ionic emulsifier, that is proteins. Okay, one can make by this. First you have to make a primary emulsion, then when one can go for secondary emulsion, then one can go with we call it as tertiary emulsion. This is the way how we can prepare this emulsion by using this oil and 2 electrolytes. Mostly this is the common proportion. One has to understand this proportion, very very important. One has to remember. So we in pharmaceutical field we use 4 types of oil: fixed oil, volatile oil, mineral oil. Only this proportion of oil is going to change, and water and emulsifying agent mostly we kept common in order to make a primary emulsion. Okay, so 2:1 is common ratio. Only this oil ratios you have to change. One has to make, then one can prepare the primary emulsion. Always primary emulsion is very very important. When you prepare primary emulsion, once you prepare the primary emulsion, then we can make it very easy to make a secondary and tertiary emulsion. Getting? Because we need this kind of preparation, stable suspense, evenly distributed. Particle globules must be evenly distributed in your system. For that, Zeta potential, electrokinetic potential is very very important. For that, you have to select proper hydrocolloids, proper surfactant. Maybe in combinations mostly we use. Okay, in order to make a stable emulsion, because the 3 system we call as we have to make a 3-phase system. Okay, we have to reduce the interfacial tension by adding some surfactant system. So oral administration of oil soluble drugs, mostly we just now we discuss all these things. Okay, it could be IV route, it could be taken by topical route, transdermal route, rectal routes. Okay, So what factor which improve the physical instability? Particle global size. Just now we discussed, when the size of dispersed globule is less, decrease the creaming. According to Stokes law, we have discussed. We always Stokes law in particle diameter, particle velocity is very very important. Always you have to also viscosity. Viscosity is very very important. Okay, because the rate of creaming, if you see, inversely proportional to the your viscosity. So particle diameter, particle size, and velocity is very very important. Always you have to keep lower free energy and higher beta potential, so as to keep the all the particle away from each other, so that they will not form a we call it as come together and they will aggregate. Okay, that is very very important. That's why mostly used for dilute suspension, less than 2% dispersed particle. Particle size distribution should be very very important, uniformly distributed. Okay, so that's why we need to check this PDI index, that is called as polydispersity index. How much globule size are there, uniform size are. Monodispersity index very very important. Okay, monodispersity and polydispersity index. Then viscosity, when viscosity increases, flocculation of globule decreases. That's why as per Stokes law, we have to maintain that proper diameter, proper density of particles, dispersed phase and your dispersion medium. Both density is very very important. You have to consider the difference should be there. The difference should be always less. Okay, should not be more. Then otherwise it will sink. The globule size will come out and it will form a coalescence. Maybe phase inversion takes place. Phase volume ratio also very important. Then density of the phases, just now we talk about that. Density of phases will be always less. Okay, should not be bigger. If difference is significant, then what happens? The sink is up, and that means the particle globules will be settled down. It will form aggregates, and again it will form a problem of instability. Temperature change also will affect on the your instability. Okay, then emulsion stability is mostly the final product is considerably stable when the following criteria were met in the products: absence of this coalescence in the internal phase, absence of creaming, maintenance of elegance with respect to appearance, order, color, other physical properties, agglomeration of the internal phase, and separation for product. Then and only we can call as final is emulsion is stable. Physical instability of emulsion because of flocculation, creaming, coalescence, breaking, and phase inversion. What is flocculation? That is fluffy agglomerates is going to form. Neighboring globules comes close together because of less zeta potentials. It can be prevented by imparting change of globule surface. Just now we talked. Okay, so we can add some electrolytes in order to maintain that. Okay, we can add proper surfactant, emulsifying agents. Creaming due to density difference. So always you have to keep proper density difference due to concentration of globule at the top and bottom of the emulsion. If it is W type, downward creaming. If it is OW, always upward creaming takes place. In case of this coalescence, compact aggregates, few globules tend to fuse each other or form a bigger globules, and due to destroyed emulsifier film around the globule, because of that this problem may arise. Breaking, cracking may be occur because of this indicate the complete separation of oil and aqueous phase like this. This is called as breaking due to completely destroy protective coating around the globules. If it is protective coating is going to be destroyed, then it will form this kind of problem. Okay, phase inversion also maybe takes place. Okay, because of monovalent soap and all of you know. Sodium stearate converted to W type upon addition of divalent soap. Example, calcium chloride and stearate. This is one example. If you put this, it will convert. It will just change the phase. Phase inversion can take place change if emulsifying, alteration of phase volume ratio, heating which damage changes the solubility of emulsifier. So always you have to think about this all: electrostatic stabilization, steric stabilization, and particle stabilization. Always you. That's why zeta potential play vital role. You have to always keep zeta potential high. Plus minus, mostly minus 20, about 20 is always be stable. Okay, that's why zeta potential can be managed by adding some suitable surfactant, emulsifying agent, proper emulsifying agents. These are the some problem of instability. Just now we talk. Then identification of type of emulsion can be done by solubility test, dilution test. In dye solubility test, mostly water soluble dyes, amaranth is used, or methylene blue dyes are used, form a uniform tin in OW. Oil soluble dyes, Sudan third, or scarlet reds form a uniform tin in W type emulsion. You could see over here. Okay, how this. And dilution test is also called as miscibility test. When the dispersion medium is added to the emulsion, no phase separation is possible. Example: when water is added to OW type emulsion, no phase separation is seen. When oil is added into W emulsion, no phase separation is seen. That is called dilutions. Okay, one can see by this miscibility test whether it is miscible or not. Conductivity test, you all of you know water is good conductor of electricity. If the conductivity is bulb is glow, then we call as OW type because water is continuous phase. Bulb doesn't glow, we call as W type. Then creaming, normally cream downwards as oil usually less dense than water. OW normally cream upwards. This we could see. Okay, that is called as creaming test. These are some references where we can refer for further discussion. I hope you must have understood The immersion